My name is Darren Dahl. I work for SSM Health. SSM is a healthcare system that's located in 4 different states, Missouri, Oklahoma, Illinois, and Wisconsin. My position is a product owner for value-based care and finance. And I've been at SSM for 7 years. SSM has had a relationship with Milliman for 8 years. The fact that SSM works across 4 different states, it does present some additional challenges in integrating all the data from those different data sources, since there are so many more. I believe we have something like 35 value-based contracts that we've integrated with MedInsight. So that's been a multi-year process, as we've kind of expanded out from our original Missouri-centric solution to one that encompasses all of our different locations. Data processing has changed a lot within the past couple of years. So it's really been a maturation process for our data infrastructure, and working with Milliman has helped with that. And one of the big items that we've been working on this past year is integrating data from our EMR, from Epic. So that's been we are looking at bringing in disease-based registry information. We have all the supplemental quality data that we send to our payers to close the quality care gaps. We're also bringing that into MedInsight, along with all the risk, the diagnosis, supplemental files we historically send to payers for their AMS processing. Also bringing in the cohorts that our care managers have been working with, so we can monitor how effective they are. And then lastly, we also have something that we just have a simple crosswalk file that crosswalks member IDs from the payers to their Epic IDs. So we can have that embedded within Epic as well. Within MedInsight as well. So really, it's a nice way to take all of that Epic data and make sure that we can bring it into MedInsight. So we have a nice, robust data mart. We're also starting to look at bringing ADT feeds in as well for that and scheduling data. So really, this has been I'm excited. We're kind of nearing the end of that, the culmination of that project. So really, by the end of this year, beginning of next, we'll actually be able to start to leverage some of that information. It's been a challenge, but it's, Milliman is doing all the hard work, so we essentially provide the data in the format in which, we've kind of agreed upon, and, they're just starting to integrate it. So I'm sure that there will be more, questions and challenges as the days go on, as we start to utilize that and find out perhaps where it's the data that we're sending falls short or just might need to be modified. But thus far, it's been one of the easier implementations that we've had. Well, I enjoy working with MedInsight. When I first started at SSM, Milliman was already there, and so this is something that I probably work more closely with Milliman than a lot of the staff members that are within my own office. So I'm meeting with them at least on a weekly basis. So it really they're essentially just an extension of our team. They have the expertise in the subject matter expertise in that claims and eligibility data, and then also all the algorithms and the risk modeling and whatnot that we don't have internally. So really, we rely on them quite heavily for a lot of that. But then they're just very good partners in us once we articulate what our goals are, working with us to achieve those goals. MedInsight's added value to our team and our whole division, really, an organization they have that subject matter expertise that perhaps that we do not have. And again, it's always been a partnership. We bring to the table the knowledge of the market, and what our systems are within SSM. But MedInsight, has that subject matter expertise. And they can also suggest, this has been successful for other clients, or you might want to focus on this. So from a strategy perspective, I think that's been very helpful. I've certainly worked with a large number of vendors, and I would say that with Milliman, it truly is a partnership. There are others where I really consider the relationship to be it's a vendor relationship, but this has been a long-going partnership As I mentioned, I've been at SSM for 7 years, and our contract with Milliman has been for 8. And so they've been with us every step of the way. So it really is a very, I think, mutually beneficial. Very much a two-way relationship.